Welcome to my channel. Today we will talk about 2019-20 coronavirus. The 2019-20 coronavirus pandemic is an ongoing pandemic of coronavirus disease 2019 COVID-19 caused by severe acute respiratory syndrome coronavirus 2. The outbreak was first identified in Wuhan, Hubei, China, in December 2019, and was recognized as a pandemic by the World Health Organization on the 11th of March 2020. As of the 23rd of March, more than 341,000 cases of COVID-19 have been reported in over 190 countries and territories, resulting in more than 14,700 deaths and over 99,000 recoveries. The virus is typically spread from one person to another via respiratory droplets produced during coughing. Primarily it spreads when people are in close contact, but it may also spread when one touches a contaminated surface and then their eyes, nose or mouth. It is most contagious when people are symptomatic, although spread may be possible before symptoms appear. The time between exposure and symptom onset is typically around 5 days, but may range from 2 to 14 days. Common symptoms include fever, cough, and shortness of breath. Complications may include pneumonia and acute respiratory distress syndrome. There is no vaccine or specific antiviral treatment. Primary treatment is symptomatic and supportive therapy. Recommended preventive measures include hand washing, covering the mouth when coughing, maintaining distance from other people, and monitoring and self-isolation for people who suspect they are infected. Efforts to prevent the virus spreading include travel restrictions, quarantines, curfews, event postponements and cancellations, and facility closures. These include a quarantine of Hubei, nationwide quarantines in Italy and elsewhere in Europe, curfew measures elsewhere in China and South Korea, various border closures or incoming passenger restriction screening at airports and train stations, and travel advisories regarding regions with community transmission. Schools and universities have closed either on a nationwide or local basis in over 124 countries, affecting more than 1.2 billion students. The pandemic has led to global socio-economic disruption, the postponement or cancellation of sporting, religious and cultural events, and widespread fears of supply shortages which have spurred panic buying. Misinformation and conspiracy theories about the virus have spread online, and there have been incidents of xenophobia and racism against Chinese and other East or Southeast Asian people. Epidemiology of coronaviruses. Health authorities in Wuhan, the capital of Hubei province, China, reported a cluster of pneumonia cases of unknown cause on the 31st of December 2019, and an investigation was launched in early January 2020. The cases mostly had links to the Hunan seafood wholesale market, and so the virus is thought to have a zoonotic origin. The virus that caused the outbreak is known as SARS-CoV-2. A newly discovered virus closely related to bat coronavirus, pangolin coronavirus, and SARS-CoV. The earliest person with symptoms was traced back to the 1st of December 2019, someone who did not have connections with the later cluster linked to the wet market. Of the early cluster of cases reported in December 2019, 2/3 were found to have a link with the market. On the 14th of March 2020, an unverified report from the South China Morning Post said that a 55-year-old from Hubei province could have been the first person who contracted the disease, on the 17th of November. On the 26th of February 2020, the WHO reported that, as new cases reportedly dropped in China but suddenly increased in Italy, Iran, and South Korea, the number of new cases outside China had exceeded the number of new cases in China for the first time. There may be substantial underreporting of cases, particularly those with milder symptoms. By the 26th of February, relatively few cases have been reported among youth, with those 19 and under making up 2.4% of cases worldwide. Government sources in Germany and the UK estimate that 60 to 70% of the population will need to become infected before effective herd immunity can be achieved. Deaths in coronaviruses. The time from development of symptoms to death has been between 6 and 41 days, with the most common being 14 days. By the 24th of March, more than 16,700 deaths had been attributed to COVID-19. Most of those who have died were elderly. About 80% of deaths were in those over 60, and 75% had pre-existing health conditions including cardiovascular diseases and diabetes. The first confirmed death was on the 9th of January 2020 in Wuhan. The first death outside China occurred on the 1st of February in the Philippines, and the first death outside Asia was in France on the 14th of February. By the 28th of February, outside mainland China, more than a dozen deaths each were recorded in Iran, South Korea, and Italy. By the 13th of March, more than 40 countries and territories had reported deaths, on every continent except Antarctica. Estimates of the crude mortality rate by the World Health Organization are 3 to 4% as of the 6th of March 2020, while the infection mortality rate, the number of reported deaths divided by the number of infections, will be lower. The case fatality rate CFR is the proportion of persons with a particular condition cases who die from that condition. During an epidemic, the death rate can be affected by quality of healthcare, general health and age profile of the population, while the CFR calculation needs to be adjusted to allow for possible under or over-reporting of cases, and for the time lapse between infection and death. Estimates of the CFR vary from 1.4%. Signs and symptoms in coronaviruses. Symptoms of COVID-19 are non-specific, and those infected may either be asymptomatic or develop flu-like symptoms such as fever, cough, fatigue, shortness of breath, or muscle pain. The typical signs and symptoms and their prevalence are shown in the corresponding table. 274. The Centers for Disease Control and Prevention (CDC) lists emergency symptoms including difficulty breathing, persistent chest pain or pressure, sudden confusion, difficulty waking, and bluish face or lips. Immediate medical attention is advised if these symptoms are present. Further development of the disease can lead to severe pneumonia, acute respiratory distress syndrome, sepsis, septic shock, and death. Some of those infected may be asymptomatic, returning test results that confirm infection but show no clinical symptoms, so researchers have issued advice that those with close contact to confirmed infected people should be closely monitored and examined to rule out infection. Chinese estimates of the asymptomatic ratio range from few to 44%. The usual incubation period, the time between infection and symptom onset, ranges from 1 to 14 days. It is most commonly 5 days. In one case, it may have had an incubation period of 27 days. In this video we have talked about coronavirus disease 2019 COVID-19. In our next video we will tell how the coronavirus disease 2019 COVID-19 mystery and as per astrology.
Press the bell icon on the YouTube app and never miss another update.